I want to, looking at the report that is just about to come out, I think by tomorrow, it stated that just about 25% of foreign aid goes to Africa. That is about almost 50% drop. So what is the scope of the foundation's health philanthropy in Africa?
Thank you very much, Daniel, for the question. So, as you know, the foundation is a private philanthropy, and we take our role quite seriously because we don't want to replace the government, or we don't want to replace the other donors as well. So the way we think about our contribution is actually to be super catalytic. It's to think about how the philanthropy, the small philanthropy money, can be the most catalytic possible. So what we do, we fund a number of innovation, especially in nutrition. So we fund a lot of studies, research, finding new ways of tackling malnutrition. And then we will bring those innovation to make sure that other donors, including domestic resource mobilization by the government, scale that up. So it's quite significant in terms of our own philanthropy. We can come back to you with specific numbers in terms of like across all the issues, how much we spend, specifically on nutrition, how much we spend. But we've been increasing our contribution throughout. So we've not got to a place where we drop our support to Africa. But at the same time, we track the global aid money, right? Because the global aid money is the money that will actually help to scale and sustain the intervention that we introduce along with the government. This is why we're very, very worried by the decrease in aid globally and the proportion that is going to Africa, right? Because even if the drop is not significant, but if the drop that is going to Africa, where the biggest need for malnutrition is, it's quite alarming to us because we're not going to be able, to scale innovation like MMS, the multiple micronutrient supplement, for example, which has a huge potential to, support women, pregnant women. So governments need additional support to actually buy most of those MMS, deliver them to the, facilities at the prenatal care services where those women are coming to actually seek services. So this is kind of like why we're so concerned, and this report is setting that, sending that alarm to say, please, donor countries, keep up your support at that high level.
Yes, I hear you, because 400 million kids are not getting the nutrients that they need, and that is really a lot of children, and therefore I'm wondering, what is the state of child malnutrition in Africa specifically?
Yeah, child malnutrition is a big issue in Africa. When you think about different causes of mortality, for example, the bulk of maternal, child mortality that has happened is actually 50% of those under 5 mortality. The underlying cause is malnutrition, because when a child is malnourished, their ability to combat infectious disease, their ability to even have, get the full benefit of vaccine is quite diminished because of that malnutrition. It's quite big. In many countries, it's close to a third of the kids in Africa that have stunting. And stunting is not a visible malnutrition, right? So sometimes people really observe the acute malnutrition, kids with marasms, etc. They have, a big belly and they are small, etc. But there is also the challenge is the chronic malnutrition. In places, other countries, it's between 30 to 40% of kids that are malnourished on the starting one. So it's quite huge. And the impact we will see, it's not now, but it's in the next 15, 20 years when those kids become in productive age. You see the report will show some of really very big numbers in terms of their ability to earn more money, their ability to lift themselves out of poverty is completely, low compared to the kids that are, well nourished.
Yeah, because we see a lot happening, especially in this part of East Africa, for example, where a number of things are happening, like the wars that have been mentioned, the new wars, the climate change impact. Like now, we've just been talking about the heavy rains just a few months ago, and now dry spell now, and the effect of that. When you look at what is happening in Sudan, what is happening in Somalia, what is happening in DR Congo, the issues of smallpox and others. And it means the children are really the ones that are suffering most when it comes to all this. And therefore, I don't know, in terms of your work, the advocacy work, the high-level advocacy, does it also involve trying to talk to the high-level politicians on these issues and how these issues affect the children and their mothers, especially the pregnant mothers?
Oh, definitely. The bulk of our work as the Gate Foundation has been on global health, right? So the foundation is known for its work in global health. We also do agriculture development. We also support women economic empowerment, etc. But global health is, by far the biggest, support that we provide. And the way we track our progress there is actually by looking at how many kids are dying every year. So that is the ultimate measure that we do. And, you've seen a huge impact from, the 2015, where under 5 mortality was decreased by almost 50%. We used to have 10 million kids dying every year, but by the end of 2015, there were only 5 million dying. But then, from 2015 to now, 2017-ish to now, it has stagnated. So what we do actually is to talk to the government, from the head of state, prime ministers, the minister of health, but also under 5 mortality is a cross-cutting issue because it touches the minister of agriculture, the minister of local planning, etc. So we really talk to them to really prioritize, budgeting, increasing more budget to health, to agriculture development, really understanding how to increase productivity of food, how to fortify foods that kids are getting, etc. And then we go down to at the county level. In places like Nigeria, we work both at the federal level, we work at the state level, we work at the local government level for all of them to really understand that the impact of their policies, their prioritization of small resources that they have as a government will have a huge impact on the under 5 mortality today, but also the ability for their kid to be able to be productive citizen, in the future. So under 5, we engage with those government at the all level as part of our advocacy.
Great, thank you for that. And now that you're talking about funding, and there's this the global fund, the Child Nutrition Fund. I think that's the main thing that you're talking about. And I'm wondering, what is the legal and institutional frameworks of this particular fund, and where is it currently? Is it something that's already working? Is it something that so that we can be able to track its impacts, or is it something that you're just beginning together with UNICEF and other agencies that you're partnering with?
Yeah, no, definitely. So, we are using this as part of the partnership that we've had, some of the examples that we've had with Gavi and Global Fund for many, many years, right? So I'm sure you are aware of Gavi and Global Fund as a funding mechanism. So yes, we've worked with them for the past 20 years because what we've learned is that when you pick an issue, you agree on a very specific issue, like Gavi, it's for immunization. You say donor countries, put in money, pool money into one basket and create a global secretariat that will have a huge ability to negotiate with pharmaceutical companies to buy vaccines at, cheaper costs, right? And to be able to actually, drive the impact. And also you work with government at the national level for them to create a budget line into their national budget for co-funding for vaccines, right? So that government is accountable to actually receive the vaccine and then, store the vaccine and then, drive the distribution of the vaccine at the facility level. So that is for Gavi. But also for things like the Global Fund as well. We've been able to work with the Global Fund, create very strong partnership with the Global Fund around HIV, TB, malaria, right? So for, this new, nutrition fund is the Child Nutrition Fund is exactly the same approach. It's an approach that is targeted, that is sustainable, and most importantly, it will work because government will be in the driver's seat. So we've started it already, working with UNICEF in place like Mauritania, in place like Indonesia, where the government has been able to put in money. They've been able to drive, to pull money from different, donors. So people contribute. And then when you look at new innovation like the MMS, for example, it costs $2.6 per pill, per woman during the whole pregnancy, etc. But if you ask any donor to buy MMS into their own, through their own processes, etc., your ability to reduce costs, to maximize the delivery will be minimal. So this is where, UNICEF, which is, a UN organization, they have offices across the world, etc. So they are really playing the role of a secretariat and then pulling government money, pulling donor money as a platform, as a bargaining to the pharmaceutical companies, etc., to bring those innovation and then get the government actually to implement it. So it's a reality, it's happening, but we will need now many, many donors to support the Child Nutrition Fund to make it a reality across the world, especially in low and middle income countries where those funds are needed to actually, tackle malnutrition.
Will the foundation have a specific role to play in this?
Yes, we do. Oh, yes, we do. Yeah, we'll continue. We're one of the founding partner of the Child Nutrition Fund, and we'll continue to budget and put in money as well.
Okay. Are you able to tell me how much you have invested in this so far?
So far, we can come back to you with some very concrete number. I'll ask my colleague Bullet to get back to you on some of our commitment. Yeah.
All right, great. Thank you for that. And talking about the MMS, I think this is really something that is so important because, as you say, and I was learning that a pregnant mother is not just feeding 2, but trillions, and your focus is on the gut. I didn't know the gut is so important, So what really is limiting the low and middle income countries from accessing this pill that you say cost about $6 or thereabouts?
Yeah, it's really $2.6 for the entire pregnancy.
2.6, not actually, yeah, thank you. $2.6. What really is the issue? Why is this becoming difficult when it's just a pill that you say needs to be swallowed? And women, I think at $2, government really can access this easily.
Yeah, so this is one of the role that the Gates Foundation plays in terms of doing our best to look at what we call market failure for low and middle income countries, right? So when you go to any facilities, I'm sure you have women or mothers and sisters and partners in your life that have been pregnant. When you go to the facilities for their ANC visit, right? So they receive this acid folic, right? So it's iron and acid folic. So as a trained medical doctor, this is what we used to give to women, right? So it's only two vitamins, right? It's one mineral and one vitamin. But if you go to Europe or to the US, etc., you see in their pharmacies plenty of multivitamin for pregnant women, right? But those are not available here, and there is no reason. It's just a market failure because there is no market. There is no most of pregnant women in rural area cannot get access to that money to actually afford it. So there's no business to do that. But at the same time, you have a huge potential for increasing the ability to have a very, very healthy pregnancy and healthy delivery if you provide those. So this is what we're trying to solve now. And by providing MMS, which is the world's best multiple micronutrient, it has 15 vitamin and mineral inside that pill. So the market failure issue that we're trying to do our best to solve is, number one, to be able to get the government to know about it. Number two, to pass law, to change their policies to actually do it. So in country like Rwanda, for example, Minister Sabin Nsanzimana has looked at it, learned about it, and then moved very quickly to include MMS as part of the program. and they've been able to ship and brought MMS. They are distributing, as we speak now, more than 50,000 women have been able to receive it in Rwanda. Minister Pate from Nigeria, for example, learned about it, changed the policy, included it, etc. They've been able to purchase in the week or two. They will ship a number of MMS and they'll start distributing. So, and that it needs to become normal for women in Africa as well to receive those MMS during their pregnancies.
Did you say Nigeria?
Nigeria as well, yeah.
Nigeria as well.
Yeah,
have they
Nigeria.
Procured or they are about to procure?
They've procured already, and it's going to be shipped in a week or two. So we can get back to you. So they are going to actually, move with the implementation as well.
Okay. Oh, that's really, really great.
Yeah.
So when looking at this again, maybe just to follow up a bit, you talked about market failure. Could awareness also be an aspect of it, or political will? Could it also be an aspect of it, so that communication and advocacy is one of the key interventions, two of the key interventions that you're also looking at?
Oh, definitely. I think, awareness and also, advocacy for, the government to be able to update their package of services that they offer based on the recent evidence, right? So for them to know that and then to be able to change and then, adapt, based on the new evidence. Definitely agree.
All right. Thank you very much. And just looking at the issue of debt and in Africa, is that something that you're also dealing with? Because it has direct impact on issues to do with poverty generally, which is one of the core causes of a child's lack of good food that is nutritionally loaded.
Oh, definitely. When you look back in terms of the progress that we've made from 2000 to 2015, etc., it was a combination of many factors, right? The combination of huge generosity from the international partners, but a sense of stability in most of African countries, both at macroeconomic level, both in security control, etc. So that stability somehow really helped in a big way. It helps to drive more private sector investment in countries so that government can raise more taxes, government can get more money into their coffers, they can borrow less, and then their commitment to paying back debt is a little bit lower. But today we're in a completely different situation. Most African countries are paying more on servicing debt, in paying the interest rate on debt, than they are investing in their health and education combined. We've never been in this kind of situation before. So it's a situation that is really, really, concerning us in a big way, because the ability of the Gates Foundation to have impact at the country level, it's only when the government is also able to have enough fiscal space to take on those innovation, fund and sustain them, to be able to pay their health workers, regularly. So because we don't pay health workers, we work through government systems, but also some very innovative private sector engagement so that we can maximize our impact. So we're very concerned about that, and we're providing, when needed, some targeted technical assistance to a number of government that need advice on, how to manage the debt crisis. We do have a team that is, really think about development finance, in general, how to advise government, etc., to do our best to really, protect as much as possible the budget that goes to health, education, agriculture development, etc. But it's quite concerning.
Thank you very much. And lastly, as we close, what are some of the key messages that you'd like to share from the Goalkeepers report?
I think from the Goalkeepers report, people need really to understand the impact of malnutrition, right? People need to pause a little bit and then really read the report and understand, how the invisible malnutrition. So, I'm a parent of kids with special needs. They live with autism. It's the invisible disability, because when you have two kids, one, let's say, got unfortunate and got polio, and they need support to walk. It's a visible, visible disability. You can see it, but malnutrition, especially stunting, it's not a visible. You cannot see it, but we are living with it every day. And a third, and sometimes 40% of our kids in low and middle income countries, have those invisible, disabilities. And that will have a huge impact in Africa down the road, because when you think about the demography, for example, Africa in the 2050 will be the most populated country in the world. The world will be looking at us to actually produce the workforce for the world. But if our kids are stunted already and their brain is not growing, their body is not growing, we cannot grow our nation. It will be just impossible for us to face that challenge of the future, in terms of the future is African. But if we don't produce kids that are able to actually understand the potential impact of artificial intelligence, understand the new technologies, etc., because we just lost them, because malnutrition is irreversible. The impact we get at the first years of age is irreversible. So that's kind of like the gravity of starting. Just that message number one. And then the big message number two is for the donor countries that have resources, for them to understand that increasing their contribution to, Gavi, to the Global Fund, to the Child, Malnutrition Fund, it's a big investment, not only for Africa, but for humanity, because we'll be able to actually protect that future generation of the world. So that will be the big two messages that we'd like to give out of this report.
Great. Thank you very, very, very much, Dr. Basinga. Really appreciate this opportunity to talk to you, and I hope we'll have similar chances in the future to interact with you.